Today I'm going to discuss what I think is the most important part of doing buyer due diligence, and that's to answer the question for yourself: how much can I produce out of this patient base compared to what the doctor did that I'm buying the practice from? I call that the million-dollar question, because that is really the only question you have to answer. And what I see today, unfortunately, with young buyers is they get so sidetracked with so much information that they can find out there through podcasts, and out there is the team approach effect, where they have to talk to their consultant, their attorney, their accountant, their friend that bought at least one practice who is now an expert at buying practices. And we're not trying to tell you not to do your due diligence, but if all that information doesn't help you answer the question of what I'm going to be able to produce out of that practice, then it's really not information you practically need, to be honest with you. And so how do you do that? Well, what's the problem with that is that we all think we're perfect dentists. We all think we diagnose exactly what that patient needs. And I can assure you, as a dentist, and my wife's a dentist, my daughter's a dentist, my son-in-law's a dentist, I could put 5 dentists in a room that were classmates trained at the same school I was, and we'll come up with 10 different treatment plans, all from just watch something to you need a full mouth rehab, crown and bridge with major reconstruction because your TMJ is having issues. So you need to go in there as a dentist and determine those things, because only you as the dentist can determine that. And as good as your consultants are, you could have the best attorney and the best consultants possible in the space, they cannot help you determine that, because it's all about what your philosophy as dentistry is compared to the owner that you're buying the practice from. And I think, to start over a little bit, I'm convinced the best way you can pay off your school loans is to own your own business. Basically, corporate dentistry exists because they're taking half the profit from you. So once you become a productive dentist and you want to buy a practice, just take charge of your due diligence. You are the CEO. So if all this information, your consultants don't help answer that question, you don't need you need to filter out that noise so you can make the best possible decision in your due diligence. I would also advise every young buyer to basically buy the biggest practice that they're capable of matching that production. So you might be a $100,000 a month producer after a year and a half. You might be a $30,000 a month producer after a year and a half. But keep in mind, the hygiene department is responsible for 25% of the production of that practice. And so you can look at practices with that metric in mind, and that is exactly where some of that profit is. And of course, the beauty of that is a lot of that profit's not taxed, where if you were an associate producing that, it would be taxed at 100%.
Discover the ADS difference today. Contact us for a free consultation.